Dr. Christopher Kim is a distinguished healthcare professional with a comprehensive background in both pharmacy and medicine. Originally from New Jersey, Dr. Kim began his academic journey at the Rutgers Ernest Mario School of Pharmacy, where he earned his Doctor of Pharmacy degree. He earned his medical degree at Rutgers Robert Wood Johnson Medical School on a full academic scholarship under the George Smith Endowed Scholarship Trust. Dr. Kim then advanced his training at the prestigious Duke University Medical Center, where he completed a urology residency. With a unique blend of expertise in both pharmacy and urology, Dr. Kim specializes in all areas of general urology, including urologic oncology, benign prostatic hyperplasia, complex kidney stone disease, erectile dysfunction, overactive bladder, and urinary incontinence in men and women. Dr. Kim is also fluent in Korean and is very passionate about advancing urologic healthcare access in the Asian American patient population. We have a lot of great content to cover tonight. So, Dr. Kim, I'll turn it over to you to get us started.
Thank you so much, Abraham. I want to first congratulate everybody. I always say this when I start these talks that, knowledge is the first step. Knowing, what you have, what options you have, and, where do we go from here? So first, we'll cover prostate overview. What is the prostate? It's the cause of all wars, essentially, right? So it's a walnut-sized gland. It's very tiny in the grand scheme of things. But if you look at the diagram on the left, there's a lot of organs in a very small amount of real estate, right? You got your bladder, urethra, prostate. So the prostate surrounds the urethra. Its function actually is with the ejaculate, and it grows as we age. And so that's why it becomes a problem. And when it starts compressing the urethra, causing problems to the bladder, is when we start thinking about the prostate. So what can happen? You can have inflammation of the prostate causing prostatitis. At worst, you could have cancer. And what we're focusing on tonight is enlarged prostate, or BPH, benign prostatic hyperplasia. So let's go over the overview of what is BPH. So BPH stands for benign prostatic hyperplasia. It is not cancer. In a normal adult, it's about 1.5 inches in diameter. And when this thing gets big, when the prostate gets big and starts compressing structures around it, is when it causes a blockage in the plumbing, I like to call it. Urologists were just fancy plumbers. And so when this thing causes an obstruction, that's when you start experiencing urinary symptoms. So I just want to reiterate, it is not cancer. So BPH is not cancer. It is similar in terms of some of the symptoms you may have, if you do have prostate cancer, but most of the time prostate cancer is silent. You won't have symptoms, but you will have experienced symptoms for your urinary stream being slow, incomplete emptying, those sorts of things. So PSA is a blood test that has been around for many, many years, and it does not distinguish between BPH and prostate cancer. What I like to tell patients is that it gives us a marker, a kind of ballpark estimate of how big your prostate is and if you are at risk of prostate cancer. So on the left versus right diagram, you have a normal size prostate and then an enlarged one. So as you can see, once it becomes enlarged, you're getting a degree of compression on the structures around it and causing an undue back pressure to the bladder, thus providing, permanent sort of damage to the bladder over time. So symptoms, whoever is on this call, probably has one or two, if not all these symptoms, unfortunately: frequency of urination, urgency, slow stream, incomplete emptying, inability to start, inability to, completely empty, or you keep having that sensation that you have more urine left. So it essentially affects your quality of life. You keep thinking about urination, right? We can't turn back the hands of time, but what we can do is we can try to reduce these symptoms, because look, 95% of men with moderate symptoms are not happy, on a day-to-day basis. It affects relationships. 49% of men have sexual symptoms, along with their BPH. And, about 51% of men say that if it interferes with their day-to-day. So who can get BPH? Anybody. It affects 50% of men by the age of 60. It's a very common prostate problem. As a whole, the US has about 14 million men, and that's a statistic from 2010. Now, is it only BPH? So this kind of goes into my philosophy. You got to think about the entire patient. Do you have diabetes? Do you have sleep apnea? Do you have blood pressure problems? These things all come into play when we talk about medicines and surgical treatment for BPH. So how is it diagnosed, right? So we use our finger for the digital rectal exam. We use our blood test. But there's a lot of other tests that we can do. We can do a cystoscopy to look in the bladder, evaluate the prostate, do an ultrasound. We can get a optimized urinary flow, essentially to see how fast you urinate and how well you empty. But that's stuff's on the left side that we do. The most important part is what you think as the patient, the self-evaluation. Your symptoms dictate how aggressive we treat enlarged prostates. So getting into the meat of the topic, what are the options? So first and foremost, going from left to right, least invasive to most. So change your diet, your fluid intake. Are you drinking a lot of caffeine, energy drinks, a lot of sugary beverages? Then you have medicines, right? You have the tamsulosin or Flomax or the alpha blockers. And then you start going into surgical treatment from minimally invasive to maximal, right? We can put implants in the prostate, use water vapor, and go as far as taking the prostate out itself. So as it dates right now, there is no FDA approved dietary supplement or alternative medicine that has been proven to help with BPH symptoms. That being said, if you're on saw palmetto or some other herbal and you're experiencing improvement in symptoms, I'm not going to tell you not to take it, but textbook answer is it's not proven to help. So watchful waiting, essentially, monitoring our symptoms, seeing how we're doing. We're not doing any medicine, any surgery. Does it work? I mean, 19% we're happy, but at the end of the day, if you wait too long, it's a fine balance. If you wait too long, you cause undue, back pressure and damage to the bladder and, damage to your kidneys. So this is something that you should, you can keep in your back pocket, but not only rely on that itself. The alpha blockers itself are the first line medicines that we do when it comes to relaxing the prostate and allowing the urine to flow more freely. And this is a medicine that's commonly used as the first option. But there are side effects. It can drop your blood pressure, cause some dizziness, and it could also interact with some other medicines as well. The next medicine is the 5-alpha reductase inhibitors. This medicine, it works on the hormones by decreasing a very potent male hormone to slowly shrink the prostate over time. But this medicine will take months to work. And so if you're looking for symptom relief right away, this would not be a optimal option. As you can see, there's a lot of side effects going on with erectile dysfunction, low sex drive, as well as breast enlargement. So resume water vapor. So this treatment uses water vapor to help shrink the prostate over time. And so this is a same-day surgery done either at our ambulatory center or at the hospital. And throughout 5 years, about 4.4% of patients will have a surgical retreatment percentage. Shortly after the procedure, you could have painful urination, some blood in the urine, blood in the semen, can have urinary tract infections as well, and some urinary urgency. So this is a short video about how the Resume water therapy works.
Resume water vapor therapy is a non-surgical treatment for BPH. Resume uses the natural energy found in steam to shrink the prostate. In just seconds, this precise technology destroys enlarged prostate tissue while minimizing any effect on surrounding tissue. Resume is a potential alternative to drug therapy, permanent implants, and surgery. It preserves sexual and urinary functions, and it's clinically proven to safely and effectively reduce BPH symptoms. Potential side effects include painful urination, blood in the urine or semen, pelvic pain, and urinary frequency, retention, or urgency. The procedure is performed right in your doctor's office or outpatient center. You do not need general anesthesia for the procedure, and Resume therapy lets you quickly return to normal activities. Talk to your doctor about Resume if you're no longer comfortable with your BPH symptoms. Drug therapy isn't working for you. The side effects from drugs are impacting your quality of life, or you don't want to have surgery or get an implant.
All right, so that's a little demonstration about how Resume works and, some of the key elements about it. All right. So patient satisfaction, about 97% of patients would recommend this, and you can kind of have a real life example here.
I found out that I had BPH. My symptoms were a slow stream, and I would wake up frequently in the middle of the night. I first heard of Resume when I was researching enlarged prostate and the procedures to repair it, to fix it. And Resume was one of them. The more I researched Resume, it was the latest and greatest technology, and I want to be part of new technology. I think technology is good. My experience with the Resume procedure was very good. After the procedure, I was a little worn, a little tired, and the next day I felt fairly good and was able to get up and get around.
Since Joe's Resume procedure, we're able to spend much more quality time together, fewer interruptions, and we're just happier as a couple. The Resume treatment has made a very big difference in our life.
All right. So the next minimally invasive option is called the prosthetic urethral lift, or the UroLift. It is also an outpatient procedure, and the only other difference here is that you actually put a permanent implant in to manually move the obstructing prostate out of the way, so it's no longer blocking the urethra. Same deal. You could have some urgency with urination, blood in the urine, some painful ejaculation. And at times, if the permanent implant is there for a while, you may also form a stone on that, which can also cause an obstruction in the future. So green light laser therapy. So we can utilize special lasers to vaporize or melt away the prostate tissue. It does not require an implant, but it does require general anesthesia. It's very effective at melting away the prostate, and through 5 years, about only 4.8% undergo a retreatment. You could have some urgency, frequency of urination temporarily, have some bleeding in the urine as well. At certain times, because of the nature of the scope and the laser heat, you may sometimes experience some narrowing of the urethra or some scarring around the bladder neck as well as one of the potential side effects. And this is just a small video about how green light laser works. So this is just showing the actual the hand piece where we put our laser fiber through the scope, which will show, and you see the green light laser firing at an angle there. And you'll see in a little bit when we go in with the scope, that's us in the surgery, kind of depicting in a cartoon format. In the operating room, we'll go in with the camera and a scope, identify the prostate anatomy, look at things, and look at where we need to start treating. And so we're entering here with our laser, we're deploying the laser there, and then we're going to start melting away the prostate tissue. So that's the laser ablating the prostate tissue away, creating a channel. And so whenever we do these procedures, we're kind of always assessing how the prostate's shaped, how it looks. One thing I will say, patients that are on blood thinners, who can't get off aspirin or Plavix, any of these, green light would be a very good hemostatic agent to use in order to create that channel so that we can urinate better. On de-obstructing the prostate. All right, so TURP, or transurethral resection of the prostate, is kind of a tried and true, has been around the block for a while. It is also an outpatient procedure. Sometimes you may need to stay one night at the hospital for observation. This procedure can also have some of the similar side effects as green light in terms of causing bleeding in the urine, frequency, urgency of urination temporarily, and also has about a little bit higher retreatment rate, about 5.8% in a 5-year marker. So simple prostatectomy is probably the most invasive when it comes down to it, to actually core out the inner part of the prostate so that we're opening a channel to urinate better. The downsides are kind of the fact that you need to enter the abdomen to do this procedure. There is a higher risk of bleeding and infection due to the nature of the invasiveness of this procedure. This next one is called iTind, where we're using a temporary implanted nitinol device. It's almost like a cage that's deployed that manually widens the prostatic urethra, and we remove it in the office in about 5 to 7 days, and that helps open up the channel. It is very minimally invasive. It has a higher retreatment rate in a 3-year marker at 8.6%. And has some of the similar side effects as the other modalities before. Aquablation uses a high pressure water jet to pressure wash essentially the prostate tissue and manually remove it. Some of the side effects include bleeding, a frequency of urination, burning with urination, and some urgency. There is a 6% retreatment rate in 5 years. This is a procedure that is no longer done because of its, you can see the high retreatment rates. So no urologist really offers this procedure anymore, needle ablation. So in summary, it's really about the patient, what are your symptoms, what's bothering you the most, and when is it time to take action? I will say, don't wait too long. There is a sweet spot of trying out different therapies and then essentially picking the one that's right for you. And that is kind of the art of treating BPH. And if you'd like to make an appointment, here's my QR code for making an appointment for me. And if you type webinar dash BPH when you enter the QR code, that'll kind of signal for you to get a priority appointment. All right, these are the references. Thank you so much.